started, can I do like
Queer. It's queer. The Q is queer.
Is it?
Just a little plug. The other hat that I wear is one of my other specialties is working with folks with brain injuries. And I'm just going to put out to you that I just got a job where I'm going to be going around Southwest Indiana working on bringing services together around providing good services for folks with brain injury and resource facilitation. So if you work in a service that might be involved with that, and you want to give me your card or whatever, I haven't started the job yet. It'll be like next month. But I'm gathering resources, and I'll be in touch. So if you have
And she'll be in Evansville, so you'll be down here soon.
I will be coming down to this area, or really Southwest Indiana. So let me know who you are, and I'll be in contact soon. Okay, so back to the LGBTQ community. So now this session is looking at really, okay, so we learned the scope of the issues and some of the challenges. How do we actually provide affirming services for folks?
We're going to start with what are services that are affirming. So really, it just means that we want to provide services like we do for everyone else that are welcoming, inclusive. We want an environment that fosters just a culture of respect for diversity, and I think we all want to work in a place like that. And that includes LGBT elders and their friends, families, and partners, and may look a little different than some of the things that we're doing. So we'll talk about what those things are.
Creating an affirming atmosphere is healthy for everybody in the agency, all the clients, regardless of their identity, all the employees.
So we'll talk a little bit about do's and don'ts. One other thing I did want to say is we did this in service for the Area 10 Agency on Aging that serves Monroe and Owen County, and they actually asked us to build an in-service for their staff on this issue, which is one of the ways we got started on this topic, which we were really happy about, and we'll talk a little bit more about the why behind that. But in terms of having a culture and an environment in your organization that is safe and affirming, one of the evaluation pieces that we got back from them within like a week, not just from the staff, but from volunteers and from clients, they were saying things like, no one has ever acknowledged me in my volunteer role that I'm a lesbian, and now people actually just say the word, and it's not a big deal, and it's okay. Like the culture changed immediately. Like it was just okay for her to be who she was, and like language changed in the organization, and everybody just sort of relaxed a little bit. So that was really surprising feedback that we weren't really even expecting, that everybody just kind of went, okay, elephant in the room named, we can move forward, and that in itself kind of made a difference. So that change in culture happens in lots of different ways, and it might play out in a way that you hadn't even thought about.
So some things to assume, go ahead and assume that your agency does have people who identify as lesbian, gay, bi, or trans. It probably does. And remember that, keep some of the basics clear, that sexual orientation and gender are only two aspects of a person's identity. There's a lot that makes up a person. Their spiritual identity, their identity in terms of their role in their families, their professions, all of that. That's part of who they are.
And we're going to talk about how to do that. So we're not just saying do it and throwing you out there. We're going to get there. Bear with us.
But don't assume that you can just identify people.
You saw in that trailer clip the gentleman saying that, a lot of the time service providers say, oh, well, we don't have any LGBT clients. Well, we certainly have heard that, and we see it, and in long-term care setting, we kind of assume that A, we don't have any, and B, right, not interested at all. 50, it's over, done, moving on. So it's just not something, it's not a comfortable subject in that setting, and we start to exhibit some strange and, see, there's humor comes with discomfort, right? So there you go. But every one of you probably has a story, right? So it does happen, it's normal, it's part of our human experience, and it's okay.
And, the other trap that folks will fall into is, I'm not homophobic or transphobic. I accept everybody and I treat everybody the same. Except treating everybody the same doesn't recognize some of the very real day-to-day challenges that certain folks might experience because of some aspect of their identity. So treating everybody the same doesn't do the trick.
So direct practice language. It is definitely appropriate to ask clients about their sexual orientations. You want to do that after safety has been established. And at the same time, we're going to talk about this can sort of help you establish safety. And we're going to talk about ways that goes in both directions.
It doesn't start from a point of assumption like, are you gay?
Right.
How do you identify your sexual orientation?
Yeah, we want to include that just like we would ask any other factual question. As when we're talking about, marital status and demographics and those kinds of things, we'll talk about what that looks like on a form. But really, it's just that same kind of question. If a client looks uncomfortable or anxious, or they kind of give you a second look when you ask that, it's okay. You don't have to push it. You can just say, okay, and just go on to the next thing. Just the fact that you ask already tells them a lot.
And the nonverbal part, the part that's on the forms, makes a huge difference too. I can't tell you how many forms when it asks marital status, I have written in my own back before I got legally married because I wouldn't put single, and I would have been married if I could have been. And so, there wasn't any comfortable, but it communicated something to me about the values of that organization, whether it was accurate or not. It could have just been an oversight.
So one of the things I operate an adult day program for folks with Alzheimer's, and I opened it from the ground up, so I had to do all the forms, right, and all the policies and all the procedures, which aren't quite all done yet. But in the forms, we were, Abby and I were sorting through stuff, and we were like, okay, what language, what spaces do we need? And we haven't had anyone who has needed to check one of these, but you would be surprised how many people have looked at our forms and said, oh, like it said something about our agency that people saw that on the form, which I didn't really anticipate. I just figured the people who didn't need that checkbox wouldn't care either way. One of my clients is retired from the Kinsey Institute, from the study of sexual and human behavior from the university, and she's been retired for many, many, many years. And she saw that and she went, cool! And I was like, I love my job.
So, asking those open questions and allowing plenty of room for honest answers and doing it within an atmosphere of safety is very helpful. Let the client guide you. Ask, am I using the term that you prefer, or ask, what terms do you prefer? How do you self-identify?
As you're writing the narrative, especially for case managers who work for the area agencies on aging, or if you're doing a client biopsychosocial or a narrative that other people are going to read and that is going to help inform them about who the client is that they're seeing and providing services for, that is a great question to ask people because it allows you to say, this is the situation, this is how best to do that. And that way every new provider that comes in might not necessarily have to ask that question or go through that. You're already going to give them a little bit of a tutorial, so that will carry on. And to make this a part, rather than just that checkbox, a sentence or two in that narrative would be really helpful. It would be a respectful thing to do.
Well, in my practice, I have a private psychotherapy practice, and I work with a lot of folks who identify as transgender or transsexual or somehow gender queer, lots of different terms. So first of all, can I ask folks in the room, is the term transgender okay, or is that something that pushes anybody's buttons? Because I can switch up terms. Okay. So I use that because most of the folks that I work with are comfortable with that term. I'll ask as I'm writing notes and such, at some point early on, especially if someone's coming to me specifically for gender issues and we're kind of working that stuff through, I'll ask, now, when I'm taking my notes, do you prefer that I use any particular pronouns? What's comfortable for you? And, because I want my notes to reflect your truth. And, a lot of times they'll specify, male or female pronouns. I have one client that I use plural pronouns, they and them, because gender is a little more complex for them. So I just ask. When they're saying, well, I'm dealing with some gender stuff, and, I'll say, well, what are there any terms that you're using as you think about yourself and your identity? What's comfortable for you? And sometimes they haven't picked anything yet, and sometimes they don't want to pick a term, and that's okay too. So I just ask. And people seem to appreciate that.
Okay, so we're going to talk about language to avoid, and
Please don't say
you know
some
what?
of these things.
We
And I'll
put this on the
apologize.
slide for a reason. If we hadn't heard it, if it didn't happen, it wouldn't be on this slide. And I promise you that people think it,
I
and
have
some of
heard
them
some
say
these
it.
things.
Yes.
I have heard people say this to me. Oh, I'm okay with that. Well, okay, I'm glad I have your approval. And I don't get offended real easily, I kind of roll
She
with that
doesn't,
stuff,
no.
But I'm aware of it, so the who's the man and who's the woman, there are people that still will ask that question. Who takes out the spiders that are in the house or what? Now, I'll just share, when I got married on the 26th, Monroe County had not changed their documents, and so we decided that I would sign as the groom and the male applicant, and Jenny would sign as the bride, because we just got dressed that day, and I happened to be wearing slacks, and she happened to be wearing a dress. But it could change on any given day, so we said we'll just trade back and forth. So,
Well, and the other thing,
and
true.
I've had people ask me, oh, you're from, wherever. And the thing is, with sub-communities, you might know somebody, but not necessarily. So.
oh, yeah, go back a little bit. Yeah, so go back one more. So, yeah, this one, Jean and I have both had this. In fact, a lot of people think I'm her and she's me.
We're interchangeable.
We are
We're
interchangeable
both
people.
middle-aged social workers of
with
size.
short hair,
with short
of
hair.
size, and we talk about GLBT stuff, and I'll be out in the community, and I'll hear somebody go, Jean, and I'm getting my groceries.
Uh-huh.
And I'm like,
I had
oh
somebody
wait, they're talking to me.
introduce me to someone else as Kathleen.
Happens all the time.
And people also assume we're partners.
Yes, they do. They do.
Because we're talking about GLBT stuff, and we're two women, and we're doing this together. So, yeah.
We
we've
should
had
really
that.
just put pictures of Jenny and John up here
Yeah.
so people can see, because they're both very adorable. Okay, go back one more. Sorry.
Okay, back one.
Yeah. So back to this, assuming that people know each other and all of those kinds of things. This sort of language, not just in terms of people in your agency, providers, colleagues, etc., asking this kind of thing, but I'm going to tell you, we're working with seniors, and we talked in the first session about olds, folks who are really older in their later 80s or 90s and have had very different experiences. Just like you may hear some of those folks say some things that are maybe a little off color or not the most correct phrasing about people of color or different ethnicities or races, right? The same thing's going to happen. So we're not just saying that somebody you work with at the desk next door might say this, but somebody in the bed next door or the room next door. If a person is out in your facility, you might be hearing that from other residents. And so having some language available to you to address that versus just, because if you ignore it, it sort of stays awkward, right? But if you just have a kindly worded, non-judgmental statement available, that's sort of your blanket statement, that can work.
Yeah. So other language to avoid, tranny, that's a slang term that some people use. It's really an offensive term for a lot of folks. And so we avoid that. Referring to people cross-dressing, we'll let you cross-dress here. Well, if a person is dressing in a way that's consistent with their gender identity, they're not cross-dressing. If you really truly see this person for who they are in terms of how they identify as gender, they're dressing in accordance with what's comfortable for them. They're not cross-dressing. And that's something a lot of folks mess up on. This is supposed to be a compliment. I never would have guessed you were born male or female. That actually is heard. Some trans-identified people that I've talked to take it as a compliment, but some don't, because it's sort of a passing judgment on how well you pass, and that, you know, you're supposed to pass somehow as, you know, a gender, and that you're not authentically who you are. And are those really offensive? I mean, I think we can all say that. Asking someone if they've had the surgery is wrong on so many levels, because first of all, there's not one the surgery. And number two, you're asking people about their private health information and the status of their genitals and or mammary glands. And I don't know how many people would feel comfortable if I came up and asked you a question about your genitals.
If it's a nurse and it's a medical setting and it's a medical question, that's a very different conversation than this,
Yeah.
as you can imagine.
Yeah.
So again, I'm going to say, even if you do sort of step in it and you're well-intentioned and you say something, whether it's something up here, hopefully not, but something, because we want to, I think most people do try to, I mean, we all have good intentions. You might say something that you realize that wasn't the best way to word that, that wasn't the best thing to say. People are generally gracious. And if overall what they see is that you care and that you're trying and that, you know, you are trying to be respectful, maybe you just didn't have the right language or you didn't say it right, most people are going to give you a lot of grace on that.
So we talked a little bit about pronouns and asking and using the person's chosen pronouns. And I've had pronoun wars with other professionals where I'm talking about a client that we share, and I'm using female pronouns and they're using male pronouns. And when I bring that to their attention, they're like, well, they haven't had the surgery, have they? And I said, well, this person identifies as female, so that's why I'm using these pronouns. And, you know, we've gone back and forth about it, and I try to educate when I can. But some people will dig in their heels and insist on using the pronouns they think fit that person. And, you know, sometimes, you know, folks get used to sometimes people slipping up on a pronoun. And, you know, if you catch yourself, say, oh, I'm sorry, and you just correct yourself. Mm-hmm. If you hear somebody mispronounce someone, it's okay to say, actually, you know, if you know that that person prefers female pronouns or male pronouns. And so, sometimes you have to negotiate pronouns, because if you're billing insurance and the person is down as female for their insurance but they identify as male, then you're going to use different pronouns for some documentation and language, and different pronouns on the insurance forms.
And certainly in services through AAAs, through long-term care providers, you're going to have to use legal names. You're going to have to use legal names, social security numbers, you know, all of those identifying things, and that's another good reason to have another space potentially on an agency form that lets you at least write something in, so people in the front office who are taking calls or whatever may know, and certainly to include it in that narrative that goes with, you know, to home health agencies and all kinds of caregivers that will go into that home.
I like the term preferred name. Mm-hmm. On forms, as opposed to, there are some agencies that use AKA, which there's a negative connotation to that, like this nefarious purpose for having this other name, or, you know, it's my other identity or something. And no, it's, you know, use preferred name is usually appropriate. Real name, say, what's your real name? No. Real sex or biological sex. Actually, if a person's been on hormones for quite a while, you know, their hormone profile is biological and matches the gender that they identify with. So, you know, some terms, assigned sex is a little better, genetic sex maybe, depends on the person, and I ask. Birth name sometimes is acceptable to folks. Bathrooms. Okay, so unfortunately, we can't do this talk without addressing the issue of bathrooms because it's the number one thing that comes up when we start talking about affirming agencies. And what do we do about the bathrooms? And people rig out, and in the U.S. Senate and House, the debate was about what about the bathrooms when they wanted to include gender identity in the Employment Non-Discrimination Act. People get weirded out about bathrooms, but everybody needs to pee. And you just want to go in and do your business and get out. I've heard people say, oh, well, I wouldn't let my little girl go in that bathroom with that client because, this assumption that there's like some sort of sexual perversion associated with being trans. And you just need to be able to use the bathroom.
And there's also, the flip side of that is I will say, some people just aren't prepared to have that conversation with a 5-year-old just yet. So there's all kinds of reasons. The bathroom is a big deal.
Yeah. So, you, number one, want to make sure that you're clear about what the policies are in your agency and be prepared to talk with clients who may complain or other staff members who may complain and be able to talk about how, this is an agency that accepts everyone. Everyone just needs to go in and be able to use the bathroom in peace and quiet. And for everyone, whatever their gender identity or sexual orientation, it's all about behavior. And if there's ever an issue with anyone in the bathroom, we welcome you to come let us know and we'll take care of that. But, so.
2 real-world examples I want to give real quick. That Area 10 Agency on Aging, who serves Monroe and Owen County. So Monroe's pretty urban, and Owen County is not so urban. It's actually quite rural. And when they did we did our area-wide assessment of clients and looked at everybody that Area 10 was serving, the largest minority group identified in the 2 counties that Area 10 serves were LGBTQ seniors. So of all the minority groups, that was the largest group. That's pretty surprising. In both counties.
Not just Monroe.
It's not just that Bloomington swung it. It was Owen County surprisingly large as well. And that really told them something about what they wanted to do with staff training and in servicing and those kinds of things. So this presentation that you have today actually came out of their desire to do that. And we had a lot of discussion in that training about bathrooms because one of the issues was attached to the Area Agency on Aging is something called the Enright Center, which is a senior center, and there's a lot of different programs that happen in there. There's senior fitness, there's dance classes, there's art, there's support groups, there's all of these things that happen, and people who were transgender, seniors, were attending these events, and the kerfluffle about the bathroom, whoo! From clients attending, community people attending, staff didn't know how to handle it. So we spent some time on that, and thankfully that's one of the things that helped, and they've had to do some education with other folks attending to kind of get that situation better addressed so people are more comfortable, and actually education and just kindly saying as a staff, here's how we're going to handle that issue, both internally and externally when we orient people to the facility, has made a big difference. The other thing I will tell you is I went to a conference, Jean and I were speaking on another topic, and they were making a really wonderful point of making it a safe space. So they put a restroom sign up on all the restrooms in the part, like if this whole section and that our conference is in at USI, changed the signage on all the bathrooms to put a male and female sign on each of the bathrooms. Great, right? Except they covered up the men and the women sign, so you couldn't tell which bathroom might be predominantly which. And that posed a little issue for me because I just walked in a bathroom and I didn't mind that this person was using the restroom, but it happened to be a urinal, and I would have preferred not to see that. So it would have been nice for me if the sign had been, the men's sign and this, and the women's sign and this would have helped me personally a little bit.
People can
So
sort.
either way is really okay, but when you're in an uncomfortable situation in an agency where you're trying to create change, that's probably not the first, like you don't want to cover up wording that might cause some orientation issues because you don't want that to crop up early on.
Okay, so agency-wide affirmation. So documents and forms and language. We talked a little bit about partner, significant other, single, married, widowed. Now, it gets complicated because there are a lot of states in which a couple might be legally married, either from out of state or even in a brief window from in-state, but their marriage isn't recognized. And in terms of legalities and benefits, that's something as a provider that you probably need to understand and know. So, you want to do some clarification around that. And having a blank line for gender is fine. Transgender, I'm still kind of iffy about whether that should be there because some people really are not comfortable with that term. But you want to give some choices. Blank line is the safest. Gender, blank line. And, LGBT seniors have not always felt safe, and many have been victimized or experienced discrimination. Therefore, they have a tendency to scan the room at a new agency or facility looking for visible signs of welcoming. And scanning the room for, do you have a safe space designation? Do you have any rainbow stuff? That's a quick sign. Do you have, various symbols?
So this says safe zone, I respect sexual and gender diversity. It's a human rights campaign.
Although that even is a red flag for some folks, given their previous stance around inclusion of gender identity in the Employment Non-Discrimination Act 1 year. They've since changed their stance, but that one can be problematic, depending.
So they're just little things, even if this is just like on a little placard you don't have to plaster the place with things. So, but just having things in the appropriate locations on the bottom of a brochure, on your bulletin board, on the, in a corner of your bulletin board, on your newsletter, on your website is a place. And a couple of things. First of all, I know we talked about language and forms, but I want to say to you, if you cannot do anything else in your agency, if you don't feel able to do anything else, if you can just get a form changed, if you can just a basic intake form and start changing language. People don't even have to say it out loud if they can't yet. It's okay. If they see it on the form and your staff starts getting familiar with seeing that language on a form, it's going to start creating some change. And those little changes can make a big difference, and they can be included then in your orientation training. So it's all right up front. So it's not this inclusive GLBT training. It's just a little small part of your diversity training that gets tucked in that helps create some change as people are just onboarded into your agency that will make them go, hey. The same thing goes with signage. Don't run back and put signage in your cubicle or on your bulletin board or say, hey, I went to this great training. We're going to be a safe GLBT affirming provider and, slap up a rainbow sticker when you're not sure you might be a safe person. You might know some of your colleagues are a safe person, but don't give the impression of a safe space if you're not sure it is safe. It really is this is a growth process. And if you indicate a safe space and it is not, and a person experiences that, you've really lost them. And that word will spread. So it has to be a cautious movement.
Something as subtle as just the artwork in your agency. If you have artwork that's like pictures of families and couples and they're all opposite sex couples, that sends a message. If there's at least, a picture here or there of, a same-sex couple, that sends a very different message. Just like, if you happen to have lots of pictures of people in your brochures or artwork or whatever, and everybody's white, that sends a message.
And that's also a good place to jump in for rural communities. We talked to somebody earlier mentioned that. So if you're working in a community that's very rural, changing language, and sometimes just in agencies, changing forms is hard. You may not be the person that can make that change. It may be a corporate issue. It may require a whole lot of work to change a form. But your diversity policy probably really could be relied upon to say, you know, I've been looking at our brochures and there's not a lot of diversity in our brochures. There's not a lot of diversity in the artwork on the walls, and to maybe make some changes that way. And again, where words have meaning and just changing a few words can make change, relying upon that diversity policy to just change. It doesn't have to, you don't have to put what could potentially be a same-sex couple on the front of the website and the brochure, but you could start adding some diversity in general. Mm-hmm. You know, different ethnicities, different backgrounds. Does that make sense? And that alone is a step forward, and you can do it pictorially. And people, even in rural communities, are so used to seeing commercials and billboards and advertising and all of those things anymore that are much more diverse than they used to be, that's probably a safe starting point as well.
So, also, you know, having books with LGBT content, people come into my office and I can see them scanning my bookshelves. And I do the same thing when I go into somebody's office. So, makes a difference. Non-discrimination policies drives me up a wall when I'm checking out an agency and I can't find on their website their non-discrimination policy easily. It needs to be out there, and it needs to be on your, you know, some of your brochures and things. It needs to be easily accessible because that says, we think this is important. We think it's important that everybody knows that, you know, we are not going to discriminate against people. But then you got to back it up with the reality of how your agency works. Confidentiality is really important for folks, and we all know that, you know, older adults are, you know, of a generation with a mindset of, you know, some privacy. There are a lot of older LGBT folks that are not out, and they're not out because they have internalized homophobia and are ashamed of it. They're just not out because that's just private. I keep a lot of stuff private. And so confidentiality is really important, and it becomes especially important when it comes to outing people as either gay or trans. And so clients need to know who has access to their information and how that info is going to be used. You need to have those conversations with folks. And asking, you know, what sorts of things are you not comfortable with being out there? All kinds of things it might be. So just having those conversations, negotiating, you know, there are some folks that maybe identify as trans and are not okay, they're not where they want to be presenting publicly as their identified gender yet. And so, you know, you just want to be careful about this.
Well, and on this one in particular, so emphasizing your agency won't discuss a client's sexual orientation with client's family or friends, that really is an important one. And I'm thinking of all of the cases that I worked on when I was an area agency case manager. There were times when, you know, an adult child was trying to support their parent and their parent just really wouldn't let them, and the adult child is the person that made the referral to the area agency on aging. And once you got in the home, you realized, hey, we might really need a POA here. We might really need to get this person more actively involved. But it's tricky, right? Because that whole release of information, who can you talk to, how does that all work? But pay attention to this, because some of the problems that maybe are in that relationship or that have caused it to be bumpy and that you're now sort of in the unfortunate position of mediating, this can be at play there. So be aware when you're talking to families that maybe the person that is living with your client, that is their partner, and they really haven't maybe divulged that to you yet. I mean, there's just things that can happen there in terms of information. So, sure. So staff and volunteers really should all have LGBT training as part of their basic orientation, along with other diversity training. This goes back to, we're not asking everybody to go back and do some big LGBTQ training, but you can certainly tuck some elements of this language, basic terminology, basic forms, your discrimination policy, orientation about bathrooms in the facility, if that's something you're going to address. Those simple things can get tucked into your orientation training just as a normal part of, you don't have to make it a big deal. It's probably in some ways better not to, and just roll it in with other things so it just becomes a little more enculturated. So this is important. Every person engaged in service delivery really needs to have training on how to confront bias and role model affirming services. So when you're talking about long-term care, you really might not have a lot of ability to create a lot of change. What you can do in your situation is make sure you're comfortable and get familiar with appropriate terminology and use it. And that if people come up to you and mention things, you have some verbiage to give them. And you can also provide some materials. I mean, you can start a dialogue. Just going back to your agency, and when people say, "How was the conference?" you can say, "Oh, it was really good. I learned a lot of things. I'd like to share some of them with you." And then in that conversation, tell them about a couple of the workshops that you went to and include this one. That's a really good starting point. And say, "And I brought back a bunch of resources that we can, some of the stuff's free and I'm going to order some of it so we can just put it in the break room." That's a great way to start.
The other part of that is also being willing to step up and address when you hear a fellow staff person or maybe a client treating somebody else with disrespect, or deliberately mispronouncing somebody, misgendering them, or making some potentially hurtful homophobic comment. Just being able to address that, and lots of people are uncomfortable, whether it's around these issues or issues of racism or whatever it is. Being able to step up and actually address it instead of letting it pass.
And you can do that nicely.
Yeah.
It doesn't have to be in a correcting way. You can just simply do it by role modeling.
Now, we're kind of moving into also outreach, because it's great if you get your organization to be a really affirming space, but it doesn't do anybody good if the LGBT community doesn't know it's a safe space. And so ways to reach out to the communities and put that message out there. One way to do that is to actually appoint a staff whose part of their duties is to reach out to the LGBT senior community. So, and how would you do that? But then also to be reviewing what's happening within the agency. So somebody's got it in the front of their brain all the time. Also talking about, if you're going to refer folks to another adjunct service, how can you be sure that that's going to be a safe place?
Especially for personal care.
How are they training their staff around these issues? And this is where you can really make some big differences, because if you're in an agency that gets on board with this, then you can be the change agent in the community and maybe offer training and invite other agencies to come to that or send their staff to it. And you can do some work around this as an agency that actually creates a much safer community for everybody.
Well, and you can also, as area agencies on aging, actually kind of have a lot of power in their communities because they contract with providers, right? They determine which agencies get money and contract to provide services. And so if you require the home health agencies or the home delivered meal agencies or whatever that you are providing services to, that are providing subcontracting services out to meet your clients' needs, they need to be able to demonstrate in their diversity policy and in their onboarding and orientation that they have these things in place. Because if not, you could do that contract potentially with somebody who can, or you could just not, you don't have to make it a big deal. You can just simply say, "Hey, this is a new rollout we're doing for everybody. We're just checking to make sure all of our providers meet these things. Can you show us what you guys do in this situation, just so we understand it? It doesn't have to be really complicated. It can just be a simple thing. And I know not everybody in this room will have, is in an administrative or managerial role to go and do that. I'm just giving you examples of things we've heard in different agencies and different ways things can be handled, to kind of think bottom up and top down about how to approach this. I also want to mention that this advocacy, so as we're talking about changes, and I'm using Area 10 as an example because it was great that they saw in their survey that this was a needed in-service for their staff and for volunteers and things. But don't assume that that all went simply, and because we're from Bloomington, that everybody's on board with everything. That is not the case. And I got to tell you, Carrie Conway, the director of Area 10, she got some calls. When people saw they were providing this service, people in the community called and said, why is that necessary? Why are you doing that? They had a couple education programs at the Enright Center, and people showed up to protest. And Carrie was in a position to explain to them, well, we did this county survey, this, 2-county survey, and this is what we found. And, we're responsible to meet the needs of seniors and be an advocate. This is our role. So she really had a lot. She was prepared, though. She had information, she had background, she had data, and she was able to be in an educational role. And a few people she just couldn't make happy. And even the protesters that came, she had really good conversations with them. And kind of the last gentleman, I think, that was there that night we showed the documentary film, he said, well, I'm not going to make, he wasn't going to make a scene, but he felt like he needed to be there with his sign, and he had a very clear, feeling on the issue. And he said, I don't, want to make any trouble or anything, but this is what I believe, and I just feel the need to be here and just to, hold this sign and protest. And we were all fine with that, because he absolutely had that right. And she handled it really nicely. So I just want you to understand that it's not, we get it. We're not saying run back and just do it because it's easy. There'll be a little bit of blowback. And so to be prepared with that, for that in advance, is just good to know.
Yeah. And if you've got the data that says, look, this is of the various minority groups that we serve, this is the largest in our area. And we've got the numbers to show that, and we are not doing our jobs if we don't, make sure we're doing our jobs well for this group.
And that might not be what shows up in your community needs assessment, but national data will back you up, and we're going to show you where to find that.
Offering that LGBT specific programming. So Area 10 partnered with an organization that we are affiliated with, and a couple of other churches locally, to bring in a film called In-Laws and Outlaws. Really wonderful, positive film, brought in the filmmaker to speak at it, and had a really, 50, 60 people showed up and had a great night, and, and that word spread in the community. That's another kind of outreach.
How many of you have seen When Harry Met Sally? Okay, and Modern Family? Those little vignettes they do, those little interviews, with the couples? They're hilarious, aren't they? Harry Met Sally, they're talking about, reception food and how they met and all that stuff. This documentary is that kind of thing. It's all these vignettes with these different couples, both straight and gay. And, it's everything from how they met to what their experiences were to different little just like quirky things about how they feel about each other's driving. But it's really fun, it's hilarious, and it's very poignant, and it's a great end. So even if you don't want to do the Jen Silent documentary and that feels like a little too much for a starting point, that In-Laws and Outlaws is a great discussion tool. Yeah.
That'll make you feel good. So bringing in educational programs like attorneys that speak to these senior-specific issues, a CPA to address tax implications. And right now, if you happen to be legally married, and you're a same-sex couple and the state's not recognizing it, just FYI, you're going to have to prepare 5 different tax returns when you go to file in the spring, and only file 3 of them. But you got to prepare 5. You got to prepare a joint federal return, 2 single state returns, because you have to file a single for the state. But to get the numbers for the state, you have to pull those off the federal return, so you have to prepare 2 mock federal returns to get the numbers to put on the single state returns. And so if you actually pay someone to do your taxes, your tax preparation bill is going to go way up instead of just filing 2 returns total.
That's almost a substance abuse risk just waiting to happen right
head.
there. You see why the risk increases.
I'm thinking about that for this next tax season.
It's not.
So bringing folks in that know something about that and can explain those things.
Right, and so if you have an attorney, I mean, how many of you do stuff on advanced directives or have attorneys come in to talk about spousal impoverishment planning, that kind of stuff? So you don't have to do someone to come in to talk about LGBT senior stuff, which actually would be great. I would highly recommend it, but you don't have to do that as a starting point. If you have an attorney that's coming, or a CPA that's coming, or anybody like that, or anybody have volunteers that help with taxes in their agencies, right? So they're going to have to be up on this stuff. So having them tuck that in and include a little bit of that on their in-service or their education is a good thing.
Yep. Okay. So creating that culture of inclusion. One of the things, staff must examine our own assumptions and educate ourselves and deal with any negative assumptions we might have or erroneous assumptions. And so we really need to do that self-examination and self-education. When I went through my MSW program, there was nobody teaching a class on these issues at that time. And then later there was a class on LGBT issues, but like I didn't get any formal training on working with the trans community, and until I got a client who identified as trans, and she was settled in her life and dealing with some anxiety issues, and several years post like the height of transition stuff, and but when she came out, I mean we talked because her identity as a trans woman in a small rural community weighed in to her anxieties. And so I said, I will try really hard not to say stupid stuff. If I ever do, I will apologize now in advance, and please tell me, and I will hear that and change that. But in the meantime, I'm going to do my best to educate myself. Because nobody at the agency was educated in these issues, and she was in my office. So that's how I got into doing this work. And I had to look at my own assumptions because I identify as cisgender. I'm not transgender, I'm cisgender. And my gender identity lines up with my natal sex. So I don't know all the ins and outs. So I had to start paying attention and educating myself so that I didn't put my foot in my mouth, even as I was trying to do good service. So we all have to look at that.
It's always unfortunate when the client who is a member of that population ends up being the person responsible for teaching us what we need to know. That's very uncomfortable. We don't want it, but it happens. And in rural social work, it really happens. And so I will go back to, again, goodwill and good intentions go a long way. So if you just say up front, hey, this is a first for me. I've never done this before, but I'm sticking with you, and we're going to get it figured out. And if you'll help me know what works for you, I will use the right language, and I will learn what I need to know, and I will help my colleagues know it too. So, just do exactly what Jean said. That will go a long, long way for people.
One last word on creating that culture of inclusion, and specifically doing it in rural communities where, Bloomington, there's still an element of homophobia and transphobia in Bloomington. It's not a perfect community around those things.
Yeah.
But the proportions are different than if you go into some of the more rural communities. And so you will get a lot more pushback, I think, in many more rural communities. One thing that I find tends to be most effective when dealing with that pushback is being really reality-based and respectful in the way you address that. And it's like, but we do have clients that do identify as gay or as trans, and I can't go to sleep at night knowing that I'm not serving them well. And we all live in this community, like it or not. We don't all like everything about each other. We don't always agree with all the decisions that everybody else makes in their lives. But how are we going to live in this community together as neighbors, even if we don't like everything about it? And, you know, this agency is committed to serving everybody and doing it well. And do you really want me to do bad service for folks or no service for folks? Now, there are going to be a couple of people that will say, yeah, you shouldn't be serving them. I don't want to go to the same senior center as them, and I won't come if you do this. Okay, there's some folks that they're just going to have to think about it a little longer, you know. But a lot of folks, when you couch it as we are all living in this community together, and everybody needs a little help, and we don't always agree with everybody else on religion or politics, or, you know, are we not going to serve Democrats or Republicans, or, you know, how are we going to include everybody? A lot of people can then navigate that, and you're actually doing them a favor by having that conversation. Life feels better when you can just get along with folks instead of being mad and shoving them to the side. It feels better. So, and it's probably better for their heart, too. Okay.
Well, clearly, after this morning, it's better.
Okay.
Evidence.
So Aging in Love is for every. This is a StoryCorps.
You guys familiar with StoryCorps? Yeah, it's great. It's
Let's see if I can do this.
Okay.
All right.
I'm gonna make sure it's
come here.
loud enough.
My partner had died of AIDS, and I had gone through 2 very, very difficult years of mourning and being on my own.
I was an aging man who's just out a few years. I came out at age 50, so I lived my life before then with friends and family and lots of love in my life, but I didn't know what this kind of love was.
Well, thank God, a mutual friend introduced us. It wasn't love at first sight, but there was some kind of a recognition.
I invited you, oh, come on up to Vermont.
They said, I'll be there. I'm staying 10 days.
I was scared.
He was scared.
You arrived, and I went over and shook hands. Hi, come on in. Gave you a bedroom
It was
7 doors
far
away.
from his bedroom as possible.
3 nights later, as I'm drying silverware, he said, come on, Ted, get real. So
We started long-distance dating. Ted would come and visit me in New Jersey.
I remember you taking me around to meet the ladies at the bank and supermarket, and I'm hanging on to you just
Holding me down to earth.
Yeah.
Yeah.
But I loved it. I'd never had any kind of experience like that before in my life.
Well, you were a real challenge for me because I knew that you had not been in a romantic relationship previously.
I remember so well before you, I used to say, I have so much love in my heart, and I want a person to come along who can have this love in my heart that could burst. There's so much of it.
I could certainly see a lot of what was there waiting to come out, and it's paid off.
When I met you, you had been living with AIDS for 11 years, so the chances at that time of this going on much longer weren't real great.
I remember the time that we were in my living room, and this is when you were still pretty frightened. And you looked me right in the eye and you said, I won't hang around for you if you get sick. And that hasn't been true at all. You were there for me, and you would be there for me.
You're a part of me. For now and a good time to come.
If I did die before you, I would hope that you would have open to the possibility of another relationship.
I can't imagine.
Once you lose a partner, for me it became a real issue, and I'd hope that you felt something similar to what I felt.
It looks like it cut off.
Okay.
All right.
So there you go. Aging in Love is for everyone. And aside from resources, that's what we have for you guys. So thank you so much.
And our contact info is here. Feel free to shoot us an email or
Oh my
call
gosh,
us.
yes.
All of our sources are on the back. They would be good to check out. And I want to point out one thing. On resources, we gave you a great big long list of resources, not all focused just on aging. And the reason for that is that to really provide good services for folks, you need to have an understanding of culture and community and the issues that people face at all different life stages. And so I have starred the ones that are specifically related to aging issues. So a lot of peer-reviewed articles and books, lots of them. If we go down a little further, oh, there are also some, like Randy Schultz's books. Those give a picture of a time and the attitudes at that time, back in the 80s, for the LGBT community. And so that will give you a little insight into sort of what some of these seniors have come through. Okay? That's why those are on there. And then if we go down a little further, films, Jen Silent is up here. Before Stonewall and after Stonewall are excellent documentaries that will really give you a sense also of what folks have lived through. Anatomy of Desire has a lot of that info in it as well. There's some stuff touching on religious questions, employment issues, parenting. 100% Woman is a really good story. Fictional films as well. Television series.
Jean sent me, we had a shorter list the last time we did this, and she's like, I'm going to work on that resource list. And she sent it to me, and she goes, it's really long. And I looked at it, and I was like, just leave it. She worked so hard on it.
Sage is an excellent source.
If there's one thing that you really need to take back to your agency, Sage is at SAGE. It's on here. Services and Advocacy for Gay, Lesbian, Bisexual, and Transgender Elders. SageUSA.org. That is a national website. It's a nonprofit. They have training materials. They have literature you can order. You can get stuff and just leave it on the table in the break room.
Yeah.
It is great.
It's a great resource.
Yes.
So I highly recommend it. The other thing is that you also,
I know, right?
I know, this is
You should have been
insane.
in the car with her for 2.5 hours.
Websites to check out. A lot of these are Indiana focused because we're from Indiana, and I did not expand into contiguous states. I apologize.
It's okay.
But, you know, Facebook, to keep up on what's happening in the real world out there and that affects the environment in which our seniors are living, it's really good to keep up to date with the changing landscape of what's going on and get news feeds and things like that. And Facebook is where I get a lot of info. I get linked to news stories. And so if you follow some of these pages, they tend to post a lot of updates on what's going on.
That's really fact-based, relevant, like hard news. It's not.
Yeah.
You're not going to get an endless stream of memes that are just like, okay.
Yeah. No, it's actually, up-to-date news stories again. So go educate yourselves and educate your colleagues and your clients and do good work.
Yeah. Thanks for caring enough to sign up for the workshop.
Yeah. Thank you.